And so give me a minute to get that going. You guys can chat and stuff, don't worry. But I look like I'm here, but I'm not, because I'm looking on Facebook.
I always feel like when I'm managing the Zoom, it's like flying a plane.
Yeah, like you really don't know. I mean, the consequences are a little less.
So I do have to pop off. This is Maida. But I just wanted to thank you all again and hope to hear from you in our email or, office phone in January.
Thanks for being
here. Thank you,
here.
everyone.
Thank you.
Bye.
Do you have a office phone number?
I do. Does it say on their streaming?
Yes, it says
Okay.
meeting is now streaming live on
Okay,
Facebook.
thanks. Yes, I don't know my office phone number, but I have chosen my, it's a code, like the last 2 digits are the house district number, but I don't, a bunch of people in the waiting room, but I don't yet, I can't remember what the first, whatever 5 digits are, or I guess that's 8 digits. Okay, letting a bunch more people into our Zoom room. Thank you. Thank you all for being here, and we're now on Facebook Live. Another Capricorn, Joel. We're here on Facebook Live, and oh, Kristen, hi, Kristen and Dick are here. So I actually meant to ask someone this earlier, but can someone monitor questions on Facebook? We did confirm that we're on Facebook, Kristen, which is usually your job. Do you have to get, Kristen, I know, I always do this at the last minute. Kristen's gonna have to get a second device. Thank you, nice to see you guys. Great, okay. So where's Doreen? So Doreen, should I do, what about the whole gallery speaker thing? We go through this every time.
Do you want to hand host controls to me and I'll just take care of it?
Yes.
Okay.
But remind me how I do that. Oh, I go to your name?
Yeah, and then hover over the 3 dots.
And then I also want to, and then especially if you stay host, you can do the screen sharing. If not, if I become host, then I can have you share the screen. This is our, every time, a little bit of technical difficulties. It is now 5:31.
You can go under security and just allow screen sharing.
Right. Okay. Thank you all. I am Lisa Reynolds, and I am the state representative-elect for Oregon House District 36. This is my first state representative-elect virtual town hall. I had quite a few as a candidate, so it's particularly exciting to be here tonight. And I'm very, very, very grateful for the folks who you will meet throughout this town hall who have given their time and are really going to share their stories of what COVID has meant to them in their lives and in their professions. So I think you all know that, I mean, I've been beating the drum on this now for 9 months. We're 9 months into the COVID pandemic. I have to admit, if you would have told me in March we'd be in this place in December, I might not have believed you, but it certainly feels like this has just been a natural consequence of how things are going. So, right now, folks, as things stand, things are pretty difficult with the pandemic. You've all seen the charts and the graphs of cases going up, deaths going up, although not at the same rate as cases. We are doing a better job of taking care of COVID patients, and Amanda can certainly tell us about that in a bit. But the country has completely failed to rein in this pandemic. Other countries have not failed. And I hate to say it, but I feel like we do have to say it. We have the worst public health system in the world. I mean, that's all we can say. We can blame Donald Trump, and he certainly played an important role in this, but our public health system has utterly failed at containing COVID. And we can talk about why that is till the cows come home. But the reality is this is a massive failure of imagination and implementation. And we have, you know, where are we at? 230,000 deaths from 280,000 deaths in the US from COVID. So, you know, so that's the really bad news. Oregon continues to have an uptick in cases. We're up to about 2,000 cases a day and close to, 100 people dying a day in Oregon. I'm sorry, it's not 100 people dying a day. I'm so sorry. It's about 20 people dying a day in Oregon. But the good news is we know what works. We know what can protect us and our family from COVID. And that is to stay separate from people who we are not isolating with, to wear a mask and to not socialize with people who are not in our inner circle. And wanted to give you though the good news, because there is some good news. I mean, the vaccine is around the corner. They are already vaccinating with the Pfizer product in England. And I'm really thrilled. I was joking with Jerry, who has people she really cares about in England, or from England. And I was joking with Jerry that, hey, I'm glad they're starting to vaccinate in England, you know, even if it's just 2 weeks before we start vaccinating in the United States, because it's always good to get those numbers up, get that denominator up of how many people have been vaccinated, because that's when we start seeing if there's any particularly bad side effects from a vaccine. The 40 to 50,000 people who the vaccine has been tested on for Pfizer and a pretty similar number for Moderna has shown that the vaccine's safe, but some of the rare side effects won't be unearthed until you have millions and millions of doses. But right now, Oregon is on track to receive close to 300,000 doses of the vaccine before the end of December. And that's just that the federal government has something like 6 million. They're expecting 6 million doses of both the Pfizer and Moderna vaccine by the end of the year. And Oregon gets that part based on our population. Oregon is choosing, like I think most states will, to follow CDC guidelines in prioritizing who are the first people to get the vaccine. Frontline healthcare workers, as well as workers and patients who are in long-term care facilities. Long-term care facilities have been the site of almost 40% of COVID deaths. So that's why that makes sense as a priority. After that, it'll be other essential workers, grocery stores, police officers, firefighters. And I think the important news about that is that tier of essential workers is strongly represented by members of the Black, Indigenous, people of color community. I think that's why we've seen increased numbers in that community. So that is one way that we're able to work on the issue of the devastation of COVID in that community. After essential workers will be people with health risks and those over 65 years of age. So I did have a future constituent ask me, you know, what does this mean for me? I'm in that over 65 group. When do you think I'll get my vaccine? And unfortunately, I don't know the answer to that. Certainly the numbers of vaccines that we're getting in December don't come close to vaccinating the people in that first tier priority group. Because remember, everyone needs 2 doses of vaccine about a month apart. And we have, you know, close to 300,000 people in that first category of frontline healthcare workers and people who live in long-term care facilities and the folks who work there. So it's starting. It's incredibly exciting. It's been thrilling to watch how quickly this has rolled out, but it's still going to be a while. And big asterisk, the vaccine has not been approved for children. And that I think will come soon. But so children aren't even on the list of you know, the rollout of when they'll be vaccinated. So it's a bit of a numbers game right now. And I'm sure, as you guys have heard, the particular problem with the vaccines is they have to be stored at 70 degrees below 0 Celsius, which is 94 degrees below 0 Fahrenheit, which not a whole lot of facilities even have that type of refrigeration. So it's going to be a logistic challenge. Other vaccines, including the AstraZeneca vaccine, which is being tested by OHSU, doesn't have that same requirement. So that will make, logistics a little bit easier for that. But I kind of shudder to think about how we're going to keep track of who got what vaccine, but we've done it before, we'll do it again. And, as a pediatrician, we are vaccine clinics. I mean, it's such a huge part of what we do. So we're getting ready for when kids can be vaccinated. We're wondering if we can help with the adult vaccination too, because like we do this stuff in our sleep. Strangely, we haven't been asked yet by the OHA to pitch in, but we will certainly offer our help. So I'm just going to keep that really brief. If anyone has any question, oh, I'm sorry. One more thing I want to say. I was able to meet with the governor today, along with my House Democrat colleagues, virtually, of course. And I asked her about this. I asked her about schools, because I have really come to the conclusion that we need to open schools, and we need to open them soon. We certainly can't wait for the vaccine. We know if we waited for the vaccine for kids, it'll be at least next school year. But what I'm seeing in my office, what I'm hearing from families all across the state, all across the country, because I have a lot of family. My boys are both in college, so they have different issues, but I mean, they have different, concerns about remote education, but it's very different from what we're seeing in the K-12. We're seeing unprecedented mental health issues and crises. I mean, like crises, like nothing I've ever seen before in 25 years of doing pediatrics. We're seeing the achievement gap widen greatly. And anyone who knows me knows I was talking about the achievement gap last December, that it was one of the reasons I decided to run for office. And I'm concerned that the consequences of remote learning are going to cause irrevocable harm to kids, that they're not going to get back this year. They're not going to get back the academics. They're not going to recover from the emotional strain. And I'm really proud of the fact that kids are incredibly resilient, but this has been really, really tough on them. Not to mention all the family strains and parents who've had to leave jobs or do less at work than they're used to doing because they've had to figure out how to supervise their kids in school. So the governor said she agreed, which wasn't, I mean, I don't think either of us were necessarily there 3 months ago when we realized we had to close schools to keep kids safe from COVID, but we've seen what's happened across the country. Schools are not super spreaders. We're not seeing rapid spread of COVID in classrooms. We know what works in classrooms. Turns out social distancing is the most important thing to prevent the spread of COVID. So of course, when I talk about going back to school, I'm talking about masking. I'm talking about, half the number of kids in the schoolroom, whatever we need to do to maintain what we know works for preventing the spread of COVID. And there seems to be this dichotomy right now, like, well, do we open the bars or do we open the schools? And I would argue, first of all, that shouldn't be the conversation. And it's pretty easy. I talk about irrevocable harm to kids by closing schools for 6 to 12 months to 15 months, we're talking. The irrevocable, I should not be using that word. The harm to businesses can really be cured with money. I call it a simple, if not easy solution. Let's pay restaurants. I want restaurants to be around when we're past this, but I don't want to have this cudgel of all these businesses are going to collapse. And that's why we're opening businesses and not opening schools. I think if we have to talk about that as a priority, the priority absolutely has to be schools. It's our next generation. It's our future. It's really important. And it's important for all the working parents out there. So the governor shared that she agrees with me. She also shared there's been some discussion about doing what they're calling a 5th quarter, which would be summer school, which I wanted them to do last summer. So I think the message has been, I think the evidence is clear to the people in the top reaches of Oregon, policymakers that we can't just keep hoping that we can just kind of muddle through distance learning, and we'll catch everyone up back when we can be in the classroom again. So I know that's something that folks have reached out to me quite a bit. Feel free to continue reaching out to me on that as well, and we'll keep you all apprised as to what I hear and learn. On that note, I am going to turn the program over right now to my dear friend and colleague and psychologist extraordinaire, Doreen Dodgen-McGee. Thank you, Doreen.
Yeah, thank you so much, Lisa. It's my honor to introduce our next couple of guests, and I'm just deeply honored. The first person that's going to be sharing with us tonight is a person who holds a huge chunk of my heart and history, one of my oldest friends, Kim Lodewijk, Dr. Kim Lodewijk. She is a psychologist in Chicago and one of the owners of one of the larger mental health provider groups in the Chicagoland area. She serves on the board of several US and international justice-oriented nonprofits, kind of focusing on issues around prison reform and care for the incarcerated, and also racial equity. The thing that I would say about Kim is that she is fully present. The night of my own crisis, our quadruple homicide in our family, I couldn't sleep the whole night and waited to be able to call my two friends in Chicago since they were ahead of us in time. And she was she was one of the first people I called, and this is her first time of sharing her story with COVID. Kim is 100% always all in, heart, soul, mind. She's the person you want on your team because she'll do whatever it takes and she'll do it brilliantly. So Kim, I'd like to hand over to you this time, knowing that we are all holding you in our care as you share our story or your story. We care about you, and thank you to your siblings who are here with us as well.
Okay, well, thank you for having me. I'm just going to briefly share a little bit of our story in the hopes that everyone learns from it and it's helpful to all of you. So it was about 8 weeks ago, exactly today, that both of my parents were diagnosed with COVID. And my family began a journey that would result in us burying both of them together less than 3 weeks later. My parents were married 66 years, had 5 children, 13 grandchildren, and 20 great-grandchildren, and were incredible people who lived life to the full. They were competitive sports fans and leaders in their community. They loved and highly valued education. My mom even got her master's degree at age 67, and they loved to travel. Even though they grew up in the same relatively small hometown in Michigan, they met on the steps of the Opera House in Paris when they separately traveled to Europe as young adults with friends. My mom was a strong, feisty go-getter, and my dad a kind, gentle, but strong leader. My 4 siblings and I were shocked at their diagnoses, as they had both been strong and healthy for most of their lives and seemed almost invincible. My father had started having some physical and cognitive decline, but they were still living independently and doing everything they could to live well and manage life during the pandemic. While we were concerned about COVID, I think all of us somehow thought they would be the ones who beat this disease. They were in the same hospital for a few days, and you can see in this picture, the nurses would bring my father down to my mother's room so they could be together. My father made progress and was eventually released to a rehab facility. My mother never left the hospital, but continued to fight valiantly. Throughout this time, my extended family did Zoom calls, window visits, made phone calls, sent texts, rallied people to pray, and did anything else we could think of to support them and encourage them to keep fighting. The medical staff were amazing. And during one of our Zoom calls with my mother was suffering to breathe and communicate with us. And the nurse promised us she would stay with her and hold her hand for as long as she could. We were so grateful for them, but it was also so hard that we could not be with her and my father to comfort them and love them through this. I remember clearly the moment I got the call saying my mother knew she wasn't going to make it and was choosing to go on comfort care. My mother was the woman who never stopped fighting. And despite her decline, it didn't seem like this could be happening. Just the day before, she had been telling us to move the car from the emergency room parking lot, change appointments for them, and order her new hearing aids. I'll never forget that drive to the hospital, putting on the full PPE and surrounding her bed to tell her that we loved her, holding the phone to her ear so my father could say goodbye, sharing stories, singing to her, and then being with her as she battled for each breath until she took her last one. We were shocked and devastated, but then we turned our focus to our father. It was excruciatingly painful to stand outside his room and tell him through the phone that she had passed, and he was in his room with only one nurse and no family. He was tearful, but there could be no hugs or even time together in the same room. 2 days later, as I was preparing to go back from Chicago back up to Michigan to get things ready for my mom's burial, I got the call that my dad had regressed and was being taken back to the hospital. I remember getting off the phone and standing in my house with 2 of my children holding and hugging me as we all sobbed together. How could this be happening? The next few days were filled with uncertainty and ups and downs. But my father's condition eventually deteriorated to the point where we jointly made the decision for him to go on hospice. Once again, just a week later, we made the trip to the hospital so we could be with a parent during the dying process. My father was very clear and told us that he was at peace and ready to go on as he no longer felt like a human being and was tired of the fight. He looked at us and said, "This is the way it's supposed to be with your family around you." As the morphine started, he reached out, grabbed our gloved hands and said, "I love you," as he shut his eyes. And then once again, we waited and watched another parent take their last breath. Since losing my parents, my family has received incredible love and support. However, I and my siblings have also been faced with those difficult interactions with people who somehow want to tell me that they think people are overreacting to this disease, that it would go away after the election, and in a recent conversation, someone said after the inauguration, and or that they don't believe we should have to wear masks. Sometimes I feel sad, sometimes angry, and other times I feel like I just got punched in the gut, and I just have no words to say. My hope as I tell my story and our story of the story of my family is that people will somehow have better awareness of how difficult this journey can be and is for so many people who are battling the illness or who are journeying with a loved one who is doing so. So much pain, the separation, watching someone deteriorate and struggle to breathe, relying on the medical staff to give the comfort that you so desperately want to give, walking through the grieving process without the hugs of people who love you, processing the hurt, anger, and sadness from all the rhetoric. I would ask you all today, as you hear the story of my family's journey through my parents' illness and eventual passings, to consider ways to reach out with tenderness and sensitivity to anyone you know who's impacted by COVID, to work as you are to raise awareness, to please wear a mask and not tie it to politics one way or the other, and to reach out to someone you love to tell them what they mean to you. Thank you for letting me share my story with you.
Kim, we are so grateful, and all of your siblings who are here. And I'd like to ask everybody, just wherever you are, to please say Donald and Shirley's name right now in honor of them. Just unmute yourself and let's all together go ahead and say Donald.
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 Shirley.
Shirley.
Thank you, Kim.
Thank you, Kim.
And now I would like to introduce to you another incredibly wonderful person. This wonderful person is Chris Kocher. Chris is the founder and executive director of the COVID Survivors for Change organization and the co-creator of the National COVID-19 Remembrance, which is an art installation and a memorial to victims of COVID-19. Chris previously launched the Everytown Survivor Network, which is the nation's largest community of gun violence survivors working to end gun violence. Chris also is is the first person in his family to go to college and graduate school, and he graduated from law school. I forgot to write down where he went. But what I will tell you about Chris, Chris makes me want to cry too. Chris is one of the most ready, willing, and able people I have ever met in my entire life. He is always looking for the people group that is hurting the most and that needs the most activism and advocacy. And then he's willing to have his heart broken over and over and over again and be present to the pain and suffering of others, and then able to do and create incredible things to change us. So I'm going to hand this over to Chris to give you a little overview of COVID Survivors for Change, and then Lisa and he are going to have a little interaction. So Chris, welcome.
Thank you so much for inviting me to be part of this, and Doreen, all the love back to you. That was very kind introduction, and thank you, Representative Reyonlds, and thank you, Kim, for sharing and having me as part of this conversation. And I think so much of what, before I sort of talk about how I wound up here and what we're doing, I wanted to just acknowledge so much of what Kim talked about that is so uniquely heartbreaking to COVID, right? The having multiple family members impacted and losing multiple family members, not being able to be in person with people, and how that has disrupted the grief process. The ongoing daily, I don't think it's an understatement to call it an onslaught from the news every day, from having people dismiss, diminish your lost question, well, there must have been an underlying symptom or condition. And all of that sort of compounds grief in a really unique way now that is really heartbreaking, and not to mention the sheer scale of people who have been impacted. And, like I said, Doreen and I connected first in the gun violence space. And as you remember, there is no, gun violence is not a little crisis in this country. Gun violence is a major crisis, a major public health crisis. It impacts communities all around the country. And COVID is still morphing that crisis by, a factor of 6 or 7. And that's just in the 6 or 7 months. So I want to share a little bit about how I wound up here. I'm talking a little bit quietly, as Doreen knows. I'm in a small 2-bedroom apartment in New York City. I've got 2 kids, one of whom is maybe asleep, one of whom is definitely not asleep. So I'm going to try to talk quietly so they don't join us. So I started, my background is as an attorney. I worked for close to a decade with Everytown and Moms Demand Action. And I started there, what became the Everytown Survivor Network, and really seeing how families who had been impacted by gun violence were not centered in the conversation, centered in the work of the gun violence prevention movement. And we built out programs to empower people to share their stories and advocate for change, to connect with each other and build community with each other. And then programs focused on care. So online support groups, connecting people to free counseling, bringing in mental health experts to share their expertise with families and survivors who've been impacted. When I say survivor, I mean anyone who has been impacted by gun violence, or when we talk about COVID, anyone who has been impacted by COVID. And, was very moved to be doing that work, have met incredible people like Doreen and some of the other folks on this call. And that was where I expected to be. And like so many folks this year has completely upended my plans. And like I said, I live in Queens in New York City. And so when that first awful wave hit the United States and decimated Queens, I'm less than a mile from the Elmhurst Hospital that was in the news regularly. I've had friends that had COVID in that initial early wave, and families at my daughter's school, and just hearing the ambulances day and night. I don't know that I'll ever really be able to get that out of my head, but I jumped into this and started COVID Survivors for Change because I thought, it's not exactly like gun violence, but there's enough similarities that maybe there's something that I can do in this space to support families and survivors who've been impacted by COVID, and not just help them advocate for change and for a stronger pandemic response that we're looking for, but also to connect them to each other. And there's a lot of online space where people are building that peer support. And I wanted to build on top of that and really bring in some of the mental health expertise that myself and others have built about how to support people who are working in trauma. So we are focusing on a couple of things, and similarly to gun violence, first and foremost, is that advocacy piece, right? As we are sitting here and we are seeing, so many multiple times more horrific and horrible than where we even expected ourselves to be, even just a couple of weeks ago, knowing that, we haven't even begun to see the impacts of Thanksgiving travel. And again, similar heading into Christmas travel. And, I'm here in New York, and today was the first day that it dipped into the 30s. And just realizing it's going to be a long and dark and cold and hard winter. And that's assuming that's even if, me or anyone in my family is not impacted by COVID. So we have a long road ahead of us, but, we're here not because it was inevitable. We're here because of failure of leadership at the highest levels of government. And we really felt like it was really important. And one of the strongest levers of change that people listen to in this country is to hear the stories of people who have been impacted. And so like what we saw in the gun violence prevention movement, hearing the stories of people who have been impacted in all the different ways that gun violence can decimate a family or a community. In this space too, we're working to really try to support people who have all different kinds of impact, whether that has loss of a loved one or have survived COVID and are living with serious after effects. So we're really trying to help people speak out and share their stories and be part of that lever of change. And I think that, we've seen some impact and, as we heard, right, things are going to get better, and they're going to get better. Now we know it's probably going to be months, not years, but months still means that we have weeks of really dark news ahead of us that we need to sort of steel ourselves for. The second piece is community. So just very similar to gun violence, connecting people to each other, building that shared experience, and especially just with the isolation that is going on all across the country. I have been completely, really overwhelmed with just how important that connection has been for people. And then beginning to build out care. So we're connecting people online through online support groups that Doreen has been helping out with, and beginning to think about, we're doing a holiday gift drive for families whose parents have been taken by COVID for those kids, and doing a special series around the holidays and coping with the holidays, right? Because what we know about right now is that literally hundreds of thousands of families, millions of people are living through the holidays, which is, this time of, supposed happiness and joy and comfort. And of course, all that is true, but also at the same time are experiencing together at the same time this a huge loss that hasn't happened in this country in, from the public health perspective in close to a century. So it really is unprecedented and not what anyone in any of our lifetimes have experienced. So just thinking about how we can support people through that. And I think, I think about where we are now, right? And we talked about this, a great deal of this is preventable. We know that, so we need to fight for a better and stronger response. We know that things are bad and they're going to get worse before they get better. But we do know that better is coming soon, which makes all of the actions that we can take now even more incumbent to just sort of steel ourselves for those next few months. But some of the things that we're fighting for are, a data-driven response and prevention plan, reopening the economy in a way that prioritizes the safety of all Americans, asking people to follow the very, basic public safety behaviors that we know work, wearing masks, social distancing, and then building out the ongoing support for families who have lost someone and for families and people that are surviving with COVID and have serious after effects. And what we're beginning to know, and what is unique about this, is that there is so much that we don't know. And even as we look to where we were 6 months ago to now, we know a lot more now, but we still have a lot more to learn. But we know that about 1/3 of the people who show symptoms have really serious after effects, right? So just from that alone, you're talking about millions of people who have, to some degree, all the way rising up to an actual to a level that renders them disabled, all the way to just sort of serious medical conditions that they need support and knowledge and care for. So making sure that they have access to that. And just a few things before I close is just I want to just stress, and I know I'm sure this is the choir, and here I am preaching, but I think things that are important can't go said enough. And I think we all can be ambassadors for this, and I know that can be hard sometimes, right? Even in my own family, and no one is on the same place in the spectrum of what they're comfortable with and what they think of. And there's a lot of judgment and a lot of, well, you did this, but not this. But we all can be ambassadors to our families, to our friends, for engaging, really what is basic behaviors to keep each other safe, like the wearing masks and really modeling that for people in public, distancing, social distancing, engaging the political process. That's part of why we're on this call here tonight. And so I really commend you all for really engaging and interacting with not just your elected officials, but each other, and being a community as people who care about what we're doing as a community to keep each other safe. And then if you want to learn more about COVID Survivors for Change, you can go to www.covidsurvivorsforchange, and I'll drop the link and my email in the chat box. We have a petition there. You can sign up, and you can also sign up to learn more or to support the organization in any way.
Well, thank you. Thank you, Kim, of course, for sharing your story. It's incredibly powerful. And I understand this is the first time you've shared it publicly. And I'm just so moved that you're here with us in a space of people who really care and who really are heartbroken by your story. And then to see this is definitely a card out of the gun violence prevention playbook. And then, to think about, wow, is there something we can do besides, I do rant with my updates and all that. And obviously I'm now an elected official and we'll be working night and day to do what we can in Oregon. But really excited, Chris, to hear about the rapid organization around survivors of COVID. And thank you for including whatever you can in the chat for us to get more involved with that work. Thank you both so much. I'm going to bring the story now, another story a little closer to home. Amanda Elegant, which is such a great name. And she's also a great nurse. I met Amanda a long time ago, it turns out. I don't quite remember.
Portland is very small.
Our paths crossed a while ago, and we were able to reconnect a few days ago through the Oregon Nurses Association, which is such a powerful advocacy group here in Oregon. But I wanted to talk to someone who's truly on the front lines of taking care of COVID patients in Oregon. So without further ado, Amanda, mother of two, and here to tell us about her work.
Yeah, so my name is Amanda Elegant. I'm a nurse at OHSU. I'm a very strong advocate of unions, and I'm a big advocate, big organizer within the Oregon Nurses Association. And I am in acute care. So what that means is I sit in between where the ED is and where the ICU is. We take patients that need hospitalization but are not needing critical care across a vast variety of different specialties. I work in the float pool, so I take care of pretty much every type of acute care patient out there. The first 3 months of the pandemic, I was on my previous unit, which is the COVID unit. So I spent the first 3 months of the pandemic acting as a charge nurse on the COVID unit, trying to figure out how we were going to figure this out. Nobody had a clue. Literally every day, things were changing in terms of how we addressed isolation protocols, how we worked with the patients, what our risks were, what our isolation requirements were. Was this aerosolizing or was it not? These were the questions we asked ourselves pretty much every day. And then since July, I've been in the float pool. So I go all over the hospital and see all kinds of different patients, including oncology patients, back to the COVID units. I was there last week, and take care of pretty much everybody. So I see the ED sees them as they walk in the door, and they can be in all kinds of different spaces as they come in. And we also, at the hospital I work at, life-flight a lot of people from around the region to come in for ECMO and the critical care. So OHSU kind of sees a unique population that way. In acute care, though, we have numbers climbing right now. We are in a currently, as I was telling Dr. Reyonlds, as of today, we have enough PPE. The question is, do we have enough PPE next week, next month? We really don't know. There's huge, in addition to issues in terms of manufacturing PPE, what's not as well known is there's huge issues with transporting PPE. There's been huge issues in those lines as well. So I've taken care of a number of really heartbreaking cases, and I'm more than happy to kind of talk about any of it, but I think I will start with a case that unfortunately isn't unique. So there isn't going to be any patient identifying information in this because there's been more than one, and that is patients in their 40s and 50s that were completely independent, living their lives before they got COVID. They went to the ICU, were incredibly sick, intubated, possibly more than once. And then they come to the acute care. They're still positive for COVID, so we take care of them on the COVID units. And their life has been devastated by COVID. They may not be in the mortality that we're discussing, which is still significantly higher than the flu, but their lives are not going to get back to where they were. And these are people that were my age. I mean, like, and it's heartbreaking to see so much of a horribly devastating outcome and then have it mocked on TV. And I think as several of us have kind of talked about how just difficult it is to have people not take it seriously when you see that impact. We've talked a little bit about potting, and what I literally am potted with my 3 house, people I live with, because I don't want to pass it to anybody. We can't get out there because I've seen how devastating it is, and I can't see family. I can't extend that pod because it's such a disease that hits quickly. There's really no way to tell if you're going to be in that unfortunate group or not. Age doesn't qualify you as, if you're 40, you'll be fine. That's not necessarily true. So it's a really hard disease to put our thumb on, and we'll know so much more 2 years from now. And what we knew in April has changed so much to now. And, we were talking about that last week on the unit, like the things we were all worked up about, now we don't even worry about, but now we have a whole new set of things to worry about. So it changes all the time. That's kind of the prepared stuff I wanted to talk about, but I think Lisa wanted to ask me a few questions to kind of flesh it out a little bit. Yeah, you're muted.
Classic. One thing, and I'm so bad. I'm not going to share the screen. I'm going to put this up here. One thing that really struck me today. So this is Oregon. This top line here is hospitalizations, which obviously are skyrocketing.
Mm-hmm.
And fortunately, ICU is down here. So although ICU cases and ventilator cases are going up, they're going up at a slower rate than hospitalizations. I was wondering if you could, your understanding of that and how you could explain that.
Yeah, so we're doing a much better job of taking care of people and keeping them home as long as we possibly can, but bringing them in when we need to. The reality is so many people in the United States have underlying health conditions. I have underlying health conditions. Take an anonymous poll here. I think there's something that qualifies for, 70 to 80% of us. So those patients are coming in at a higher rate. And here's the rub, is that they're filling up an already full hospital. OHSU is full most of the time. Like, we rarely are not full. And so most of the hospitals are that way. We're working on an area that is so difficult in the best of times because we don't have extra beds ever. Right. And so now
you mean like even pre-COVID? Even pre-COVID, right?
Yeah,
right.
This is pre-COVID, a year ago.
Right.
So now we're filling those beds up with patients that are sick and have COVID. And what's happening to the rest of the patients? A lot of them do have underlying conditions that are then getting triggered by COVID. And so we're seeing them come in because now they have heart failure and COVID. And so they have 2 reasons to have respiratory issues. And so while they may have been okay at home, COVID is bringing them in. The reality is we just have so many more COVID patients than we did in the spring. I remember one day in May looking at the numbers and saying, 40 cases, we're finally lowering our numbers. And I started to panic when it started to hit about 300. I miss those days desperately.
Yeah. Yes. And then my understanding is, I think, and correct me if I'm wrong, because again, I'm not a hospital-based doctor, thankfully. Back in the spring, people were more quickly going onto ventilators. And now my understanding, and talking to Dr. Maxine Dexter, who is actually a state representative, is like, we're doing everything in our power to keep people off ventilators, like laying people prone, which is face down, seems to give them a little more lung capacity so that we don't have to rush to a ventilator. Because I mean, I always knew once you're on a ventilator, it's really tough to get off, but apparently in COVID, that's even more the case.
That's my understanding. So I don't work critical care, although I
Mhm.
do talk with critical care nurses. There is a lot of proning. It's something we've done in the past for really bad pneumonias. The problem is we're seeing it even more with COVID patients. COVID patients that they stay in the ICUs longer, and then so if they're not moving through the ICUs, then the ICU numbers are there's going to be increase in the ICUs is what I guess I'm trying to say.
Yeah.
Even
Yeah.
if we use ventilators sparingly, I'm lucky in that I have access to so much great information. I love the press conferences that Governor Brown does, because she brings in such great, she had Dr. Edwards from OHSU and Esther Chu from the ED up at, she's a physician there. And they have so many resources to really deal with it. But that being said, like I have nursing school friends that are all over the Portland area in terms of hospitals. And I'm just hearing horror stories out there in acute care. Patients that are tenuous at home and they get COVID, they're going to come in. That's the reality. And we can probably manage a lot of them at the acute care level. We manage a ton of stuff because we're used to it now. But how long that manages, we don't know. There's a question here about the crisis implementation plans. We will give 100% full care as long as we possibly can. And when the beds are, it's not even so much the beds, because we can expand all over campuses. It's staffing those beds. Right. Like I am vent trained. I am one of the few acute care nurses at that is actually vent trained, but I am not vent trained at the level you would deal with a critical care patient. It's a different type of ventilation system. And so once you're out of ICU nurses that are trained to do that, then you're having PACU nurses do it, who are ICU quality nurses, but it's not what they do every day. And then you're having nurses that are used to taking neuro ICU patients, taking respiratory patients, and that's just not their standard training, and you can't retrain somebody quickly. And so even if we can find a bed and staff that bed, you're not going to start getting the same quality care. I know Oregon has done a lot of work coming up with triage plans. My understanding is we've not enacted those yet.
And
we don't want to. We really don't want to.
Right. I know. That's why we need to keep all those things, masks and all that. And then just lastly, I'm wondering if you certainly alluded and you shared this with me, because I will say that, it is heartening to see that we are seeing the rate of death from COVID hasn't risen as high as the cases. Of course, a lot of that is the lag, right? Mm-hmm. But this devastation, what are these people's lives looking like? And it does not get talked about at all. And it's, I think, pretty a real negligence on lots of people's part, including journalists and politicians and
nurses,
the medical world.
We're not talking about it as much. So I've had patients that were completely independent, worked full-time before they got COVID, and then they went to the ICU. They were incredibly sick, came out of the ICU to my floor, and they hadn't been out of bed in 4 weeks. They have a tracheotomy, which means they're now breathing through a tube in their neck rather than through their mouth, because they've been on a ventilator so long. We're trying to wean them off that trach so that they can breathe through their mouth again. It's often very difficult to do, and they haven't walked. And so I don't know, without really, if you have ever had a loved one who's been injured and unable to get out of bed for 2 to 3 weeks, trying to regain that strength is almost impossible. You have to work at it 6 days a week, multiple hours per day. And even then, there's a good chance you're never going to recover to where you are. So these people are now disabled as a result of having COVID, where they worked full-time before. They may be able to be productive, but it's probably not going to be nearly at the same level. And that doesn't even begin to talk about the neurological issues we've seen with COVID. I have a friend in her 40s who never went to the hospital with COVID. She caught it in April. She's still falling down randomly because of the neurological issues long-term she's encountered. Hair loss, all these weird things that we don't understand yet. We don't know why.
Yeah, I'm super concerned about that, right? Like, remember, when I think back to shingles, right? This reemergence of the chickenpox vaccine in the form of shingles. Is there going to be some reemergence of COVID? The vaccine will help protect against those things ostensibly as they have with chickenpox, but I think there's so much we don't know. So I know this is not a news alert to anyone here, but COVID is dangerous. COVID is terrible. Thank you so much for the work you're doing, Amanda. Guys, this has been a pretty intense but really important 45 minutes, and I'm really grateful for all of you who've been here, and particularly Kim and Chris and Amanda for sharing your perspectives and your stories. It just adds to our understanding and thinking about how we need to do things differently. As I often do, I want to ask Doreen to kind of, I don't know, Doreen, center us a little, give us just some, I don't know, I want to say words of wisdom. That sounds so cliche, but we do need to keep working and fighting, and also going easy on ourselves. So tell me your thoughts, Doreen.
I guess I would just say 4 things. And the first one would be to help, to go from here tonight and use what you've learned, what we've all learned, to have some hard and important conversations. Maybe even just informing people about the things not to say to someone who has had COVID touch their lives. Either someone else has been sick that they know, or they have been sick. We don't want to ask about pre-existing conditions, or do we really know if they died of COVID? I mean, these are things I hear every week in the groups that I help with Chris. We don't want to ask about their age or say at least they've lived a long life. We want to think about talking with folks about what we can do to be empathic, good neighbors, more than what we can't do just for ourselves right now in this holiday season. After that, I would love to encourage everybody to make sure they're doing really diligent self-care. One of the things that I think is so sad is that, well, I don't need to go into that, but just making sure that we're getting plenty of light in the winter, plenty of fresh air, we're moving our bodies, and that we're dealing with, giving ourselves nutritious food and also nutritious information. Do not doom scroll right now. We know that COVID is real. We know what our part is to stop it and prevent it. Instead, let's use our energy doing things like advancing Chris's work with COVID Survivors for Change, or getting involved in our state in terms of our COVID response. So let's be proactive, giving ourselves, again, nutrients, media, and food. Becoming proactive in your own plan about how you are going to be safe. You're going to wear a mask, you're going to stay distant, you're not going to have large gatherings indoors. And then being proactive in communicating about those plans with others, so that you don't find yourself in compromising situations where then you're stuck. That is another huge thing you can do. And then the final thing is just check in on each other, especially check in on children. Offer them FaceTime calls or long calls, or send them gifts. Do something with them, get on a FaceTime call or a Zoom and just make a craft together. But do really check in on our children and adolescents. Check in on our frontline folks, including civil servants. I was doing a support group with a different group yesterday, and 2 women who work in the prisons have now gotten COVID. And so think about those people who are facing, particular risk: nurses, physicians, postal workers, grocery store workers, all of these folks, and check in on them and offer them the same kind of care that you're going to offer to yourself with self-care. So those are the things I would offer.
Thank you. I mean, it does feel particularly challenging, right? I mean, it's just like, it's like you could almost not design a more devastating thing to happen to our country, because it's the illness, it's the suffering, it's the death, and then it's not being able to be together, whether it's comforting Kim and her family, or at least, being able to be together during a time when there's so many emotional challenges. Do take care. We're gonna, I guess I want to ask if there's any more questions. Doreen, you look like you have.
I'm going to say one other thing. Chris, you mentioned like work for holiday support for families. Is there anything intentional that folks can do there? Or how do we find that out?
No, I mean, what we're doing, well, two things. One is, we're running online groups like you mentioned. And so I think just, sharing that as a resource, we have a link to it from our website. So if you know anyone who could benefit from that, please share that. And we have the ability to connect to families who are looking for holiday support in the form of if people are unable to provide gifts, in financial circumstances. So for families who have been seriously impacted by COVID, if that's either you and you need help, I'll drop a link in the chat box, or if you're in a position that you can give help, that's another way to help out in the holidays. Sign up to complete a holiday wish list of some needs and wants for some kids who otherwise might not have that joy this season. Yeah, those are I think the two things most of all. But I mean, just I think the human message of reach out, and there's calling people and saying, how are you doing today, is a really it's a simple, direct, and covers sort of everything phrase. And I think I've never heard someone say to me after they experience grief or trauma, not obviously the first few days, but weeks or months after, wow, I really too many people reached out to me. So I think sometimes we think that we're intruding on people, but I think just reaching out, a text, an email, just letting people know. I just saw someone today posted, someone left a note and a poinsettia on someone whose daughter died from gun violence on their front step, right? And they don't know who it was, but it was just a meaningful. So just really basic things like that, reaching out to people or don't know who've experienced loss. There's, especially this year, and especially what we've are experiencing together as a nation, as a community, I think there's no shortage of that love and support that we can show to each other.
Thank you. Thank you so much, everyone, for being here. Stay safe, reach out. I mean, I'm here in Portland. I'm happy to help anyone who needs anything. But stay safe and be well, and we will get through this together. And as Doreen and I keep saying, we can do hard things. I mean, we've already been through a lot, and I think there's going to be more coming our way that's going to be difficult, but I do really feel that there's a light at the end of the tunnel. But let's all be there for each other, and just most importantly, stay safe. Thank you.
Thank you, Lisa, for doing what you're doing and getting this going in Oregon on the government level.
Yeah. Thank you. Thank you, Doreen. Thank you, Kim and Chris and Amanda especially, but for everyone who's there and sharing this space together. And I'll make sure to post all these links and stuff in the social media.
Thanks, everyone.
Thank you.